Welcome back to Morning Joe. A little before 8 o'clock here on the East Coast. Beautiful shot of the U.S. Capitol. The Medicare enrollment period is open now through December 7th. And for the first time in the program's history, out-of-pocket prescription drug costs will be capped at $2,000 a year. Enrollees will also have the option, for the very first time, to spread their out-of-pocket drug costs across the calendar year instead of having to pay all at once. Both of these changes were provisions in the Inflation Reduction Act, which passed after Vice President Harris cast a tie-breaking vote in the Senate, and then President Joe Biden signed into law back in 2022. Joining us now, NBC News medical contributor, Dr. Vin Gupta. Dr. Gupta, great to see you again. So tell us why that change right there matters.
Yeah, Jonathan, we don't talk enough about open enrollment, but this is a period, about a 2-month period here in the fall, where people can choose. If you're on Medicare, you can choose the plan that's best for your needs. Sometimes people's healthcare conditions change. Big deal, though, and this is credit to the Biden-Harris administration. This is something that has been decades in the making, but this $2,000 out-of-pocket maximum on your drug spend, if you're a Part D enrollee, that's what covers your drug benefit for Medicare enrollees. There's that out-of-pocket maximum now. Very consonant with the insulin cap, $35 a month on your insulin needs, and that Medicare, that prescription payment plan where you can spread out the cost over the course of the year. These are big savings potentially for patients on Medicare. And again, it's something that we really need to talk about as open enrollment really sets in.
Dr. Gupta, younger Americans, there's a lot of focus on them in this election too, but there's new research coming out that's showing that they're getting a lot of anxiety from these extreme weather events. I mean, aren't we all, right? So of course it's affecting young people. Can you talk a little bit about that and how do you measure that anxiety? Tying it to these events.
Yeah, so a circle of life, Mara. We're talking about Medicare on the one hand, and younger generations and climate. This is, to me, there's some silver linings here. There's this study now that's talking about something that we've been talking a little bit more, which is the impact of extreme weather events on younger generations. And what we're seeing is that regardless of political affiliation, if you're a young American and you're a Democrat, if you're a young American and you're a Republican, you're worried about what you're seeing around you, the air that you're breathing. And they want government action. 96% of Democrats polled in this survey, 74% of Republicans said government needs to do something about climate. We can't have something different every 4 years. So that's number one. Number two, something that was released on Friday showed that we need to start talking about the health impacts of climate change. Sometimes people roll their eyes when they hear the word climate change or the phrase climate change. But if we focus on the health impacts, big surveys show that this is actually what resonates with people, can persuade voters because it touches them, because they feel the extreme heat on their skin. They are breathing in the toxic air into their lungs, and that's what really resonates.
And that anxiety, of course, could lead to high blood pressure. And I know hypertension is something you wanted to talk about this morning as being such a leading risk factor, but yet so many Americans afflicted with it don't know they even have it, nonetheless know how to treat it.
Yeah, Jonathan, this is not a sexy topic, which is why I don't think we talk a lot about it. But blood pressure, high blood pressure is the leading risk factor for death across the United States, has been the case for decades. And what this study found, just in one of the leading journals in America, JAMA, found last week that 120 million adult Americans have high blood pressure, 90 million have uncontrolled high blood pressure, 60 million don't even know they have it. And really, the reason here is we don't have great screening tools. And so this is a call to all your viewers out there, actionable call. 100 million people have access to healthcare benefits, have access to a provider, primary care provider. They just don't actually make an appointment. So this is a call. We're talking about open enrollment, optimizing your healthcare benefits. Make an appointment with a primary care provider because this is the leading risk factor for death across the country, heart attacks, strokes, you name it. We can do something about it.
NBC News medical contributor, Dr. Vin Gupta. Dr. Gupta, I'm sure we'll speak to you again as we barrel into the fall, winter flu and COVID seasons. Thank you for joining us this morning. Up next here, we'll move back to politics with a